Chronic lateral ankle instability, causes and differential diagnosis. Patient will come to the doctor with a complaint about the ankle giving away frequently and feels unstable, and maybe there is a history of some pain. This condition can be caused by lateral collateral ligament injury of the ankle. However, it can be caused by multiple other factors. Ankle sprain is a common injury that occurs in sports, and the lateral ligaments is the most commonly injured ligaments in the ankle. There are three ligaments on the ankle joint on the lateral side. The anterior talofibular ligament, which is the weakest, and you can use the anterior draw test to test that ligament. The posterior talofibular ligament is the strongest, and the calcaneofibular ligament, which is usually injured after an injury of the anterior talofibular ligament, and that calcaneofibular ligament is tested by the talar tilt. If the patient cannot bear weight after what you suspect an ankle sprain, then you need to get an x-ray because the patient may have a fracture. Usually you treat acute ankle sprain by immobilization, by ice, by physiotherapy, and rarely surgery. Sometimes these ligaments doesn't heal and become incompetent and creates a chronic lateral ankle instability. You may want to examine the hind foot for varus malalignment. Occult varus can lead to treatment failure. Check for peroneal muscle and tendon weakness, which is a frequent cause of lateral instability. If you find a hind foot varus, then you will need to do the Coleman block test to differentiate between fixed and flexible hind foot varus. The treatment will be different. Treatment. The majority of ankle sprains heal with time, rest, physiotherapy, which will include perineal strengthening and proprioception and range of motion of the ankle. However, in some cases, the patient may not get better. The patient may have mechanical instability or functional instability, and the patient is not improving with conservative treatment. So the patient will need surgery. What type of surgery? Anatomic repair, which call it prostrum, is direct repair of the attenuated ligament, or modified prostrum, which is direct ligament repair with augmentation using the inferior extensor retinaculum. You can use a graft if the prostrum technique fails. And you're going to look for other conditions like peroneal tendon pathology, fracture, joint lesions, arthritis. There's a lot of differential diagnosis for this area that can create an ankle instability. These are some of the other causes that can create the same symptoms of pain and instability. When pain is posterior to the fibula, you can blame the peroneal tendon pathology. Peroneal tendons are subjective to excessive repetitive forces, causing pain, swelling, and instability of the lateral ankle. Peroneal tendon pathology, like tenosynovitis, is treated by injection, maybe surgery, synovectomy. The superior peroneal retinaculum is usually holding the two tendons behind the fibula. The inferior retinaculum is not important. Superior peroneal retinaculum tear may lead to subluxation of the tendons. you will do physiotherapy or reconstruction of the superior peroneal retinaculum. Peroneal tendon subluxation occurs with dorsiflexion and inversion, but is tested with dorsiflexion eversion against resistance. Peroneal tendon tears, it can be the longest or the brevis. The longest can be torn, and you can find the os migrate proximally. The brevis can be torn with peroneal tendon subluxation. In these cases, you will do repair or tenodesis. How about lesions inside the joint? There are several, like osteochondral lesion of the talus, OCD lesion of the talus. There are two types. It can be medial or it can be lateral. Treatment, non-steroidal and therapy. Then you do ankle arthroscopy, you debride, you drill, you curette, you fix. It depends on the situation. Anterolateral impingement. The anterolateral impingement can be caused by a soft tissue thickening, and it is seen in athletes with prior trauma that extend into the ankle joint. You do physiotherapy and injection, you scope, you debride that impingement. Ankle synovitis, you do synovectomy. Arthritis of the ankle joint usually results from prior injury or inflammation to the ankle joint. It can be diagnosed by an exam or by an X-ray. You start with conservative treatment. You will have a brace. You do injection, and if nothing works, then you end by arthrodesis or total ankle. If there is a loose body inside the ankle, you remove it. There might be some fractures that's causing the instability, like lateral process fracture of the talus, anterior process fracture of the calcaneus, Jones fracture or pseudo-Jones fracture. The treatment is specific for the fracture. Then you have tarsal coalition. You need to diagnose it and treat it accordingly. Tarsal coalition can cause frequent ankle instability. Thank you very much. I hope I was helpful to you.